Hi guys, this is Dr. Bhupesh once again from Dr. BKM Institute. So today we are going to know about the OET speaking assessment criteria. So this is from the original site of OET. So if I tell you one by one, so these are the skills. Again, this is very hard to understand because intelligibility obviously means that you know that your tone should be good, listeners should be able to clearly understand you, fluency should be there, professional language would be there, then resources of grammar and expression should be good. Obviously these are the things. Relationship building, obviously that means you should say, oh, I really understand, I understand that you are having trouble with this thing. Oh, don't worry, I'm here to help you, we assure you for the best services. So you have to understand from the patient perspective as well. So all these things are important. But when I talk about these things, obviously this is a kind of a subconscious things, that you have to attend to the patient carefully, you need to listen to him carefully, then you need to attend him carefully, tell him exactly what he wants to know. So that is what all these things means. Okay, information gathering means that how many questions do you ask, so what actually got to the, how do you how did it happen, when did it happen, so question like these. So this is what they want to say. But when it comes to the original things, obviously this is very important, but when you will do speaking, the better you do, like the way I am talking to you right now, if I would be speaking effectively with you, you would be getting to know that sir is having confidence, he is speaking well, he is attending me well, and he is trying to resolve my problem. So my voice will tell how good I am in my work, so that talks about my intelligibility. And also, if I take your questions, okay, ma'am, tell me what are the problems you are facing in OET speaking. Then you tell me your problem. Okay, don't worry, I will resolve this problem. So talking like this is very important to address the problems of the patient. So that is what they want to say. But now talking about few things, can I write on the role play cards? Yes, you can write. You can refer to the card at any time. You can make notes. तो role play cards पे आप लिख सकते हो. And you can refer to the card. आप कभी भी देख सकते हो. और कार्ड को वापस करके आना है. What if I do not finish the role play? So that was your question. Each role play is designed to elicit an accessible sample of speech which reflects your speaking ability in a health professional text. It is usual for a role play to come to a natural at around 5 minute mark. Around 5 minutes means 4:30, 4:45, 5 minutes. 4:30 पे भी कोई बात नहीं. If this does not happen, the interlocutor will signal clearly. आपको वो signal कर देगा that it is time to conclude the role play. अगेन आई एम टेलिंग यू, वेरी वेरी इंपॉर्टेंट. अगर आपके दो, आपका एक पॉइंट रहता है, लेकिन अगर आपको एग्जामिनर कंक्लूड करने को कहता है तो रीअश्योर करना इज वेरी इंपॉर्टेंट. कंक्लूडिंग अ टास्क इज वेरी इंपॉर्टेंट. So there is no penalty for not completing all the elements. That is what I am saying. There is no penalty for not completing all the elements. However, the more elements you cover, the more evidence you are likely to give your ability to communicate in spoken English. Use the preparation time to think about which elements on the role play required to explain something in more detail. तो ये आपको चुनना है कौन सा ज्यादा अच्छा है बोलने के लिए, कौन सा कम. ठीक है, बाकी दिस इज अगेन सबकॉन्शियस थिंग. व्हाई सब, हाउ विल द सब स्पीकिंग टेस्ट वर्क विद एन OIT on a computer? So obviously this, for the people who are taking, you will interact with the interlocutor via Zoom like we are interacting right now. What scores on the level descriptor do I need to reach on the speaking task? So you should aim to achieve the highest level in descriptors for each criteria. Test takers securing grade B all have predominantly scores 5 out of 6 on each linguistic criteria. And to, again, this does not make, हमें समझ नहीं आएगा ना ये क्या बात है. मतलब what I'm trying to say is speak your best and role play पे कुछ भी लिखो. If you are unable to finish, अगर वो इशारा करता है, if he passes on a gesture that your time is about to get over, तो please conclude the task in a very nice way. And these are the most important instructions you should follow. So this is Dr. Bhupesh from Dr. BKM Institute. Thanks to the original OIT site that we could read this information. Plus, but please try to read these information when you have time. When you have extra time, try to invest in OIT original site, because that will give you the actual knowledge of OIT. So this is Dr. Bhupesh once again, and take care of yourself. Thank you.